Alright, here we go. We good? Alright. Imagine, it's World War II, you're aboard a Navy destroyer in defense of your country, in war-torn South Pacific. You're witnessing the worst that war can bring, but through all of this you can't help but recognize the afflictions of the people there. They are sick, hungry, and dying. Their plight not a result of war, but rather a lack of simple medical necessities. This is a scene that was experienced many years ago by Dr. William B. Walsh, and it moved him. It touched him so much that he felt compelled to make a change. He envisioned a floating medical center that would provide medical health education and improved care to communities around the world. And when his vision finally came to fruition, it resulted into one of the largest healthcare charities worldwide known as Project Hope. It began in 1958 when Dr. Walsh was able to convince President Eisenhower to donate the former naval hospital ship USS Constellation, and with the help of many people and several organizations, it was able to be transformed into the USS Hope. The USS Hope was the first ever peacetime hospital ship, and it set sail to over 10 different countries, providing medical needs to communities around the world, ranging from Vietnam to Colombia. After spreading care for over a decade, the USS Hope would be retired in 1974, and Project Hope would switch their emphasis to solely land-based operations. The spirit of USS Hope is continued, though, through its partnership with the U.S. Navy, which sends medical volunteers around the world providing medical care and education. Since its switch to land-based operations, Project Hope has remained dedicated to making health care available around the world. They now give aid in over 35 countries on 6 different continents. Their commitment to long-term health and sustained health care includes educating health professionals and community health experts, strengthening health facilities, and fighting diseases such as TB, HIV/AIDS, and diabetes, as well as donating medicines, medical supplies, and medical volunteers. The help that Project Hope provides has been evident in recent years. After natural disasters hit both the Gulf Coast in 2005 and Haiti in 2010, Project Hope was quick to respond. When Hurricane Katrina hit the Gulf Coast, Hope sent volunteer medical response teams to the area, providing nursing needs wherever it was wanted. Hope would continue to help in the Gulf Coast when it was hit by the hurricane, and in 2006, they would help staff the U.S. Navy, Mercy, and volunteer efforts in South Asia. In response to the earthquake in Haiti, Project Hope helped to coordinate volunteer efforts on the USS Comfort. The program's results have been demonstrated by its successful implementation of health education. Its humanitarian assistance programs have been highlighted in medical journals, applied in case studies, and presented at international global presentations. It has also been developed into posters and other medical materials. Project Hope has raised over $100 million for its health efforts in the last year, making it one of the largest charities in the United States. Over the years, they have maintained a reputation of financial integrity and efficiency. Project Hope works hard to maximize all dollars received. More than 90% of their resources go towards their life-saving healthcare efforts, which is amongst the highest in philanthropic organizations. The following video is an example of what their resources go towards.
In Malawi, tuberculosis is a major cause of disease and death, especially among people living with HIV/AIDS. In 2006, Project Hope initiated a 5-year project in the Mulanje and Polombe districts of Malawi to support the National TB Program and improve TB case management and treatment outcomes. We work at the health facility and community level to increase knowledge about TB to ensure that people with TB get into treatment as soon as possible. Part of our program includes training and supporting community volunteers to help detect people who have TB symptoms in their communities and to work with them to provide counseling and coordinate testing and results. More than 400 volunteers have been trained and mentored. We've increased community sputum collection sites to 60 to provide increased access to TB diagnosis. Results have been inspiring. TB treatment success rate in the Mulanje and Polombe districts has increased from 60% to 86% in the 5-year period. Case fatality rate has decreased from 20% to 11% during the same time period. Visit the Project Hope website to learn more about our work in Malawi and around the world. Go to projecthope.org.
Since its inception in 1958, when Dr. Walsh turned a vision of help and hope into a reality of health in dozens of needy areas around the world, Project Hope has continued its mission to achieve sustainable health care globally and will continue to give health care wherever it is needed.
Includes training healthcare workers, improving the quality of the laboratory network, and mobilizing